Good afternoon, everyone. Welcome. My name is Marilyn Shannon, and this is the Breaking Free Show. And thank you so much for joining us today. It's always a pleasure to have you from wherever you are, all over the world. Thank you for being here. And as always, we try our very, very best to bring you the greatest shows that we can, tools, strategies, techniques, philosophies, people, personal stories, anything that we can that will help self educate us so that we are more and more freer, that we can do all the things that we want to do, that we feel empowered and strong, and that we can be the ruler of our own lives. And that's very important. And before we get started, I want to say good morning, good after, what is it, afternoon or morning? It's whatever it
It
is.
is afternoon.
Amnon, hello.
Hello.
How are you?
I'm fine, thank you. How are you?
Good, I'm good. Everything is good here and sunny in North Carolina, so we'll get glad for that. We have a beautiful day in the neighborhood, right?
Yep.
And so Amnon is our producer, and he's going to be taking care of all of the cool things that go on behind the scenes. And I just wanted to let you all know that you are more than welcome anytime during the show to call in. Jot this number down if you're at a landline or cell phone, 919-518-9773. You can Skype in with us at computers, that's plural, the number two, voice, anytime you want. And also, we have a chat that you are more than welcome to partake in. If you go underneath the video that you're watching now, you'll see a little line. It says nickname. Put any name you like in there and come into the chat, and you can ask questions. You can engage with the other people that are in there. So today, I'm really excited to be having the conversation that we're going to be having because it's not one that, sometimes we like to talk about, we like to think about, but it is an important conversation. And I'd like to welcome my guest today, Dr. Eric Morse.
Thank you.
It's nice to have you.
Thanks for having me.
It's my pleasure. And Dr. Morse is an addiction and sports psychiatrist, and we actually work together. I actually have an office in Dr. Morse's practice, psychiatry practice, and I'm really honored to be here, to be there. So I'm really excited to have him here because we're going to be talking about addiction and what's more than that. We're going to be talking about spirituality and all kinds of things. So thank you for being here.
Oh, my pleasure. Thanks for having me.
So, what is addiction, really?
I think addiction is a brain disease. I think a lot of people think that it's a moral failing, but I believe that addiction is a very predictable neurochemical disease. It's often genetic. It usually runs in families. Um, Obviously, the choice to use that very first time, sometimes that's in our control, sometimes that's not in our control, especially if someone is prescribed medications by their physician and they're not warned about how habit forming the medication can be. Then they can be in a situation where they're using a substance and a switch just turns on in their brain that really makes them need that substance, where they don't feel normal without it. And so oftentimes it's not a choice to use at that point. They feel like they have to use a substance in order to feel normal, not even to get high.
So, when you say that a switch in the brain, so do we all have that possibility of that happening, or so certain people are more uh, predisposed to that than
Yes,
others?
I think there's definitely a genetic predisposition. I think if you're using a substance long enough, um, you'll become physiologically dependent on that substance. So you may not have any predisposition, but if you're using it often enough for a long enough period of time, you're going to see that you get physiologically dependent on it, and it may turn into a psychological dependence as well. Um, but there's no question that some of that switch can be more of a finer switch or more you know triggered switch for folks who have the genetic predisposition.
Hmm. So, so is it? I guess. Do you see a lot of families with the same?
Yes, I see a lot of families. It's oftentimes it's multi generational. It's siblings. Once I can get one of their family members clean and sober and functioning at a much higher level, the rest of the family sees the success that that one family member is having, and so they refer their other loved ones in to see me or one of my practice partners. I won't necessarily see a spouse
Get the benefit of
at the
probiotics
same time.
if you continue to eat.
So I might refer a spouse to one of my colleagues at Carolina Performance, but siblings I'll see, parents, children I'll see very frequently.
You said something about it's a mind. What did you say? What was the word you used? Did you say something that's a mind thing?
Brain
It's
disease.
a brain disease. So explain
It is a
that.
brain disease.
So what do you mean?
Well, I mean, there's neurochemical reactions to any substance that we use, and then we can actually see structural changes in the brain. So, using linkage studies and functional MRIs, we can see that there's actual brain changes, structural changes in the brain when someone is addicted to a substance. And so it's very predictable, very biologic. And so the treatment really needs, in those situations, need to be, medical and biologic.
And then once you treat or begin treating, do you see changes in this brain disease?
Yes. I mean, the changes that you see when people get clean and sober are also very predictable. Does a brain completely repair itself? Often not. And so that switch can be switched back on very readily. So that's why people oftentimes, they'll say, just one use can bring them back to their addiction to where it was before treatment.
So you often hear about addiction, alcoholism as being a soul disease. How does that relate to what you're saying?
I think addiction is a biologic disease. There's no question that some of the underlying reasons that someone will use initially or continue to use may be related to their soul, something they're missing in their lives, and something that oftentimes spirituality can assist with in healing. But I'm a big believer that it's a biological, very predictable disease, chronic in nature. So oftentimes people think that they're going to do a 28-day program and be cured. It can't be cured in 28 days. It can't be cured with just a detox. Treatment is usually lifelong. I usually recommend in treatment that you want to get at least a year clean, sober, and stable before considering, stopping treatment. So it is usually a lifelong illness that requires treatment lifelong.
So when you talk about life treatment, you're talking about medication, you're talking about therapy. What is in that treatment?
Yeah, oftentimes I think it depends on the substance, but often most addictions require medication. The medical evidence for medication assisted therapy, ranges depending on the substance between 60 to 80% success rates. Therapy itself, 12-step meetings, you see success rates, between 5 and 15%. So as a physician, I want to practice evidence-based medicine. And I think it's important that the recommendations I make are based on science, based on outcome measures, and usually medications are required. There are some substances that medications haven't been shown to be effective against, cocaine being one, marijuana being another, that there may not be a medication to treat those two addictions, but there's no question for opioid addiction, which is a growing addiction, so that's painkillers and heroin, medication really is required. I think alcohol and benzodiazepine addictions, medications are extremely helpful. And and need to be used. And most physicians don't know the success rate differences. So a lot of physicians will say just go to AA or NA. Um, but I really think that borders on malpractice because physicians are only recommending 12-step. Um, your success rate goes from about 80% down to 10 or 15%, according to medical studies. And I think if you looked at any other field of medicine, if you were recommending a treatment that has that much of a difference in outcome, that would probably be considered malpractice.
Wow. I never even thought about it. It's interesting. So, marijuana, what do you do for that?
So, marijuana has an extremely long half-life in the brain. In your body, it has a very long half-life. Usually takes about 30 days if you're using chronically to get out of your urine, and then to get out of your brain, it's even longer. In a way, that's nice because it almost self-tapers. So if you were to stop marijuana, you would still be getting marijuana in your brain for a significant period of time. N-acetylcysteine is commonly known as NAC, is the only medication, or it's actually an amino acid that has been shown to be somewhat effective in treating marijuana addiction. But other than that, that's right now that's all we have that seems to be effective. And the nice thing is that that's an amino acid that you can get at any fancy grocery store or vitamin shop or GNC. But other than for adults, I mean, I think 12-step meetings and counseling and seeing a therapist is what's recommended. For adolescents, it's usually family therapy has been shown to be the most effective treatment in kids and adolescents in treating marijuana addiction, cannabis addiction.
I could see that. I mean, you got to have the family in there, I would think.
Yeah, I think the more honest you are about your use, the more honest you are with your loved ones, be that family or friends, the better the success rate. No question about it. You need the support of everybody around you. Everybody needs to be aware and checking in with you and supporting you and answering your phone calls when you need someone to talk to. So honesty is always the best policy in recovery.
And in group in family therapy, you're referring to the honesty about it, people coming together and sharing and kids, teens exploring what's really going on and people
Yes.
listening, and that's really important.
It's so important. I mean, the support there, but also the parents and the loved ones are also learning about enabling. So oftentimes in our addictions, we have family members that we can count on to provide us the resources to continue our addiction, be it money, be it gifts that we can then trade for drugs. So a lot of the family therapy is actually helping family members with the concept of tough love. Tough love it's tough, but when you really love someone, you're not going to support their addiction. You're not going to give them what they need other than supporting their recovery. So, most of the families that I work with, the loved ones are maybe paying for their treatment, but they're not paying for their recreational drug
Anymore.
And that's one of the things we work on.
That's a big deal.
It is a big deal. It's not easy because oftentimes the person who's suffering with the addiction is very adept at pulling on heartstrings, saying that someone stole their phone, or someone robbed them, or something that really makes you want to help that loved one, but oftentimes supplying them with that extra money or that extra expensive item, then is turned in for drugs. And I've seen it time and time again.
Very interesting. This is so interesting. I mean, because there's so many things it's so pervasive and it's so around us, all of this stuff. And I have some questions on the chat that I want to ask you, but I think it's important to clarify We talked about what is an addiction, but really, is an addiction just having a couple of beers at night, every night? I mean, what does it look like? And yeah, did you?
Yeah, and I think that's an excellent question. Is my one or two glasses of wine at night or beer, is that an addiction? I think oftentimes what I'll do in those situations when folks ask me that is say, well, let's see if you can give it up. Let's see if you can go a week without that substance. And if you can, then you're probably not addicted. If you can't, then I think we have to take a closer look at it and consider alternatives.
So, so under the umbrella of addiction, you would have alcohol, you would have drugs, you would have cigarettes.
Yes.
What else would you have? Sex?
Yes. Any repeated behavior can be an addiction. So I see a lot of sex addiction. I see a lot of internet addiction. Facebook can be addictive. Um, I see food addiction. Um, so there are plenty of behaviors that if you're doing something repeatedly and it's taking over other aspects of your life, so it's affecting your personal life, it's affecting your work life, then that can be considered an addiction and can respond very, very nicely to treatment.
What's a treatment for Facebook?
So, obviously, one of the things you want to do is try to. The first part of treating any addiction is just awareness. Mm-hmm. So, trying to set limits, trying to, specify what half hour or what hour you're going to use to be on Facebook, and then setting clear limits. For a lot of my folks, they've tried that on their own, or they try that with me in sessions, and they're not able to stick with what they need to stick with. And so I find that naltrexone, which is an opioid antagonist, it's a medication, it's generic, it's very inexpensive, is extremely effective in treating non-substance addictions. So gambling, sex addiction, internet addiction. Extremely effective in reducing cravings. So it binds to the mu receptor in our brains and really reduces the euphoric response to stimuli that things that we do that normally gives us a sense of calm and peace. Extremely effective. It's often not prescribed. Most physicians aren't aware of the medication, but the studies on it are very strong, and there's not, people aren't studying it right now because it's gone generic. So there's no money to be made in especially oral naltrexone. There is a My Life Recovery Centers in Raleigh just opened about a year ago that's doing naltrexone implants, and they have a patent on naltrexone in the implant form. It's good for 6 months to a year, extremely effective in treating opioid addiction and alcohol addiction, and probably would be extremely effective in treating other behavioral addictions. But right now they're just limiting it to alcohol and opioids right now, the clinic is.
Well, I want to ask you something about what you said about the euphoric, but I want to answer some of this first. So somebody on here said she's heard that there is something called an ACE, a score, which is adverse childhood experiences. She's wondering if addiction cases are more likely to be genetic or the result of lifestyle experiences which then cause the gene to be expressed.
I think that's an excellent question. Most people think that addiction is the number one risk factor to develop an addiction is genetics. It's actually number two. The primary risk factor to develop an addiction is age of first use. So our brains are in childhood and even up to the mid-20s our neurons are still pruning itself. And the younger you are when you first get a taste for a substance, the more likely you are to get addicted to it. And most of the folks been working with have tried that substance in their early teens, so 11, 12, 13. And because their brains are still forming, it becomes more hardwired in the brain. And there's no question that that then becomes much more difficult to treat. Trauma, whether it's physical, sexual, emotional, is probably one of the leading causes for a young teen to try a substance. They use it to escape their reality very often. And I think it becomes more hardwired in the brain when it's effective in treating the trauma. And so I think that is studies have shown that is a very common co-occurring illness that also requires treatment. So there needs to be trauma recovery work done. A lot of trauma specialists, though, won't work with you if you're actively using substances. So the treatment often has to go hand in hand because it's hard to get into recovery if you're still experiencing trauma and re-experiencing trauma. But then it's also difficult to have trauma recovery if you're still actively using substances because the trauma is not being reworked in a different part of your brain. So oftentimes recovery from post-traumatic stress disorder and an addiction have to happen at the same time.
And that, honestly, that makes so much sense because it becomes part of their norm,
Yes,
right? So if it just becomes part of, it's all you know.
absolutely.
And that leads me into what you were talking about, a feeling of being euphoric. So let's say with Facebook or any of these types of addictions, you are addicted to feeling euphoric from the experience of being on, the rush, the adrenaline rush, so to speak.
Yes.
Right. So, but at a certain point, once you've done this addiction, once you're involved, you're active in the addiction, do you bypass the feeling of being euphoric or having an adrenaline rush, and then then that's not even there anymore, I would think, right?
Correct.
Then what?
So, right. So then you're just using or you're doing a behavior just to feel normal. And that's most of the folks that I work with is the euphorogenic benefit of doing that thing or using that substance wears off. But when I stop doing it, I go into withdrawal. So I go into Facebook withdrawal. And I can physiologically be sick. And so I need to check my Facebook because I have this constant craving to know what has taken place since the last time I've logged on. And so you can start sweating, you can start feeling sick to your stomach, you can start shaking. I mean, the physiologic response to even a behavioral addiction can be very impressive and compelling. That makes somebody then do what they didn't want to do, and that's get back onto Facebook. So that's why. But I think you're right. I think the euphorogenic effects wears off pretty early in the addiction.
It's just like when you drink too much. I mean, I'll have a drink here or there, right? So I drink, but if I drink over my amount, I drink past the part that felt good,
Yes.
right? And that's the only way I can associate it, right?
Right.
As a person who I'm a busy person. I love looking at my email. I could easily think of being addicted to email. I don't know if I could put my phone down for a week. If you asked me to do that, I don't know what I would do.
You'd have to go on vacation probably, right?
Vacation?
Yeah.
Are you serious? Don't they have wireless there?
Well,
Even
you
the boat has wireless.
You may be a workaholic then. You can't take vacation. I struggle with that myself. If you can't take vacation, you may be a workaholic.
Oh my goodness! Well, I work with the right person though to help me there. Help me, Dr. Morse. I mean, but really, did you ever think in medical school and when you went through all of your training, did you ever think that the addiction would go into the kinds of things you're working with?
No, I mean, I'm not a high tech person at all. Still not. And I think the immediacy of what for my folks who are addicted to like internet porn, I mean, you can see exactly what you're thinking about seeing within a few seconds on the internet. I mean, things that are bizarre that you wouldn't even think of suddenly is, on your screen, on your phone or your iPad or your laptop within a few seconds. And so that immediacy of getting what you want when you want it, I I just can't. No one could have anticipated that, and we're seeing a younger generation. Um, 3-year-olds are getting on their iPads and can look at whatever they want to look at, and how that's going to change their brains, and how pervasive will addiction be 20 years from now? There's no way to know. It's some scary stuff.
That is scary. And the other scary thing that just hit me is how addicted our society is becoming.
Yes. No, there's no question that pretty much every addiction is on the rise.
On the rise.
Yes.
Any age group, any
Yes.
gender, wherever, country, doesn't matter.
Yes. Socioeconomic status, race, age, gender. Looking at the epidemiology, it's everybody. The increase of addictions is affecting everybody.
It's crazy because we don't think about these, like we're talking about. We don't think about certain things being so. I mean, coffee. I mean, how many people are addicted to coffee, for Pete's sakes?
Right.
And you don't think about that as being bad.
Right. And there's some studies that show that drinking 1 cup of coffee a day might reduce certain diseases.
Right.
But do you need the brand that you need, and do you need to pay the $5 to Starbucks every day when that $5 could go to something maybe a little more productive? It's amazing.
And how do you feel when you listen to, when you hear about McDonald's French fries or Wendy's French fries that have whatever they have in them to cause us to eat more French fries?
Right.
What do you think about that?
Yeah, our food science, to make things more addictive. Obviously, there's like 30 substances that are added to cigarettes to make them more addictive. Yeah, we're using science and our knowledge of addiction to actually sell things, and we're taking advantage of our propensity to become addicted. It's unethical.
It's unethical.
There's no question, but there's a lot of money to be made in it, and that, I think, people can be addicted to making money, and I think that people can justify using science in perverse ways in order to satisfy their own addictions.
So it's the whole landscape is changing, isn't it?
Yes.
So here's another question. Chris wants to know, what does Dr. Morse think about the importance of addicts asking for forgiveness from those they've hurt as a result of their behaviors and choices?
That's an important step, and it's usually tied into the 4th and 5th step of in 12-step recovery. It is one of the more challenging things that some of my patients have to deal with, and oftentimes it triggers them to relapse. But I think it's essential that folks take an inventory, apologize for the things that they've done in order to move past it. They really do have to do it, and it's one of the most challenging parts of recovery. It's painful to go through that process. It's often painful for the person you have to apologize to. And then, oftentimes, though, we have people guiding them in that process. So you have a sponsor, you have a therapist, you have an addiction psychiatrist to help you and decide how to do it, when's the best time to do it, if you should do it at all. There's certain folks that are going to be injured in the process, where maybe it's, not in their benefit. And I think that that's an important aspect to think about is, am I doing this just for myself, or am I also doing this for my loved one? And if it's just for yourself, then maybe it doesn't need to even be done. But I think it's an important step in recovery, no question about it.
And I'm sure it's something that would be somewhat analyzed during therapy, because if it's
Yes.
not done for the right reasons and for the then it's not
Correct.
may not necessarily be done and serve anybody's purpose. In fact, it could work, it could
Against them.
boomerang and work
Yeah.
against people. So that's an important aspect of the therapy. So when somebody is looking for a psychiatrist or a therapist, who do they look for?
Well, I think you want to have somebody who has experience. So somebody who is licensed, I think, is important. So for therapists, it's often in North Carolina anyway, it's somebody who is certified in addiction. So that would be a LCAS, Licensed Clinical Addiction Specialist. So you might want to look for those initials behind someone's name. But if you've got a PhD, an LCSW, a LPC, but they still have a good amount of experience, they've worked in, a recovery center of some sort in the past, and they've got a lot of experience, then I think that's absolutely fine. And for psychiatrists, you want some board certified in addiction psychiatry, but that's very hard to find. But if you can find a psychiatrist that has experience in treating addiction, that's also hard to find.
Why is that hard to find? Why do people don't go into it? Why is it hard to find?
So most psychiatrists don't treat addiction. So when I was a resident at UNC back in the late 90s, at 2 in the morning, 3 in the morning, the only folks that would usually wake me up and need my assistance at a strange hour were folks who were suffering with addiction. And so there was a lot of what we call countertransference. So that's my feelings as a psychiatrist towards my patient, or the reaction of the patient to me. And so I actually did not like working with folks who suffered with addiction early on in my career, and I needed to go get extra training to help me with it. And once I had the proper training and realized that addiction is a brain disease, not a moral failing, then I had a better understanding of it and had more sympathy and empathy. And but I don't think that is something that the vast majority of psychiatrists have. Most psychiatrists will actually screen out addiction. So if you're suffering with some sort of addiction and you mention that before you schedule an appointment, oftentimes they'll say, I can't help you, that's not my specialty, why don't you see somebody with more addiction experience? And it's because they're not trained in how to do it. In the 4 years that I had in my psychiatry residency, I had 1 hour lecture on addiction, and that was the brain biology of addiction. I had 1 hour of training, and it wasn't enough, and obviously, and that's why I knew it was a hole in my knowledge base, and I knew I needed to do an addiction fellowship to solidify my knowledge on addiction.
Well, to begin, so I have a couple of questions about this. So to begin with, what drew you to addiction anyway?
To be honest, what drew me to addiction was I knew I wanted to be a sports psychiatrist. I enjoy athletics, and I work for NC State and United States Olympic team, and I've worked with a number of professional teams and leagues, and I loved the work. But I knew that addiction was a main reason why a professional league or team would want to hire a psychiatrist. So to make myself a more marketable sports psychiatrist, I knew I needed to be a certified addiction psychiatrist. But in the process of doing my addiction fellowship, I fell in love with treating addiction. So as much as I enjoy treating athletes, I also enjoy treating folks who suffer with addiction.
You fell in love with it. That's such an interesting way to say. So what? Could you explain that some? What do you mean
When
by
I
that?
fell in love with it, I just enjoy what I do. It is very rewarding work. I get more thank yous from my patients, I think, than any other physician. I really feel like I save lives. I just love the work that I do. I feel very passionate about it. I am growing more clinics, the Morse clinics. So I have 3 opioid treatment programs, one in Clayton, one in Henderson, and one in Siler City. And I'm in the process of opening 3 more this year. So I'm opening one in North Raleigh, one in Hillsborough, and one in Zebulon. And I plan on growing more in 2017 as well. I just love the work. I love helping people, and I've just fallen in love with the work.
You know, I just want to take a side note here because this is, so interesting a conversation because in so many ways it's so hard for many of us to understand, the process that somebody goes through that's, addicted or and the family members. There's so much, it really when they say sometimes that in AA it's a disease of the family. It really is. Everybody gets involved. And I guess I'm so honored, I'm going to say this, to be working with Dr. Morse in multiple ways because the fact that somebody could care so much day in and day out to work in an area that you do get thank you, but it is not an easy task. It is not you don't just give somebody a pill and they feel better. This is an ongoing practice. It's ongoing work. And I don't know, I guess you maybe you help, there's more people that don't recover than do recover. Is there the rate
I
of
think that's
recovery?
probably true. A very small percentage of folks who suffer with addiction actually try to get treatment. And it's I think for opioid addiction, it's the last study I saw was about 11% of folks who are addicted to opiates are in treatment. So, and you look at something like hypertension, it's 85%. If you look at diabetes, it's pretty close to 90%. And yet, this brain disease has such a strong stigma against it, going up against it. It's not just the patients, it's also the providers.
And
right?
the culture.
So doctors don't want to ask about it because they don't know how to treat it. They'll ask about symptoms of hypertension or diabetes, but they're not going to ask questions about addiction because they don't know how to handle it. They haven't been trained on how to handle it. And so we all want to take a blind eye to it. I think you're right. I think the vast majority of folks who suffer with addiction never get treatment.
So you'd really have to be an advocate.
Yes.
In this domain of psychiatry, you really have to be an advocate. It's not something that you just do. You're just a psychiatrist but you really have to be an advocate because it's so deep and it's so pervasive that you really have to keep caring. You can't.
Yes, you have. It's usually a lifelong disease.
But for the doctor, for the psychiatrist.
Yeah, and I think that if you're not well trained, most of the addiction psychiatrists that I know burn out. They stop doing the work, and it's because they take it home with them. It's because they often get tired of being lied to.
Right. So it can't be about your ego
Yes.
as a psychiatrist. You can't be. It's not a numbers game. It's a lifelong. It's a lifelong for the patient, but it's also lifelong for the life. Do you stay with people
Yes.
that long?
So I opened my practice at Carolina Performance in 2006. I have a good number of patients that are still with me in 2006. They're all in recovery, and they want to stay there. And so they may not see me, very frequently, but they're engaged. They continue to remain engaged in treatment because they know if they don't, they could relapse.
And they stay with you.
And they stay with me.
And you stay with them.
Yes, we stay together.
You stay together. See, it's not like you just see somebody once in a while and you're done. It's very
Right.
different than that.
Yes.
And so I could so understand why some doctors don't do it.
Yeah. It is challenging work, but I think you also have to you have to have the right mindset. You have to realize that it's a chronic disease, and I don't think most physicians see it that way. I think that's the problem, is they see it as a curable
Or they want curable,
willpower.
right? And they want curable psychiatry.
Right.
In other words, they want things to come to them that they know they can cure
Yes.
and move on. This is not that.
Correct.
I never thought about it like that
Yeah.
before. That's great. That's really so. Here's another question: can you give us a stat on how much addiction costs our country on a yearly basis in terms of lost wages, medical issues, etc.?
It's in the billions. I mean, I think it's pretty close to 100 billion. The last time I looked at a study that looked at that, and so it's much cheaper to treat addiction. One of the biggest expenditures that we have is our penal system, right? So we've got a lot of people in jail and prison instead of on maintenance therapy for addiction. And we're spending $60,000 a year to keep someone in jail or prison instead of a few $100s for medicine, and instead of being a burden to our
Right.
system, they could be contributing and paying taxes, and that's 99% of the folks I'm working with are paying their taxes.
Kids too. I mean, not just kids paying their taxes, but
Right.
the same type of philosophy extended to our children, because look where they end up.
Exactly.
So listen, I just want to remind everybody out there, I haven't done this in a while because I've been so engrossed, but if you would like to call in, please feel free to do that. If you're on Blab, you're welcome to call into the studio as well, 919-518-9773. You can communicate with us also on Skype computers, that's plural, the number 2K voice. And you also, I just want to remind you, can join us on our chat. You can put your name underneath our video on our website and come in there as well. And if you're on Blab, please feel free to join us. So what have we, based on your knowledge, and we've been covering a lot of different ground here, what have we not spoken about when it comes to addiction?
Just I think I've touched on it, the importance of medicine in treating recoveries, the difference in outcome measures for maintenance therapy. A lot of money is spent needlessly on detox and rehab. Some of the real popular places like Sierra Tucson or Promises or in Malibu, or that claim to have a very high success rates. They don't, and they cost $30,000 for a 30-day stay. That's like $1,000 a day. That is not money well spent. That maintenance therapy is the way to go. So for opioid addiction, that's naltrexone, methadone, or buprenorphine. For alcohol addiction, benzodiazepine addiction, oftentimes that's Antabuse, that's acamprosate, or naltrexone. So I mean, those medications are often offered to folks who suffer with addiction at rates of around 1 to 2% by medical professionals.
So you think that if somebody as a has the option, they don't, as opposed to going to those residents, they can go on a program that you would be offering. They would go to therapy. They could
Right.
at the same time going to AA, taking an art class. I mean, there are things that people can do
Yes.
that would be a good um, a good therapy system for them to
Yeah, a good
good
treatment plan.
treatment plan.
Yes. And you don't have to, go away from your family for 30 days. I mean, you can still function at a high level. And most of the folks I see are still functioning. They still have jobs. They don't want to lose their job. And so there are things we can do that are extremely effective that don't require, a 28-day stay somewhere,
Which isn't
out of
enough
state.
anyway.
which is not effective.
It's not
Not
enough
effective
anyway.
and really usually a waste of money. And these treatment centers are not practicing evidence-based medicine either. So I think it's almost criminal what these treatment centers are doing, that they're not offering medication-assisted treatment to the people who are there. Why? Because they want them to relapse and they want them to come back and pay the money again. I believe that it's an industry that is tainted.
Feeds on itself.
It feeds on itself. There's no question that.
Yeah, because 30 days, that's nothing. How
Yeah.
can you? That's like how can you? You've been addicted for however many years. You're going to
Yeah.
go somewhere for 30 days and be able to.
And most of these treatment centers, I could understand, excuse me, if they, a lot of them don't set you up with aftercare.
Well,
I mean, it's unbelievable. So, you're spending all this money, and when your stay is over and you've paid for as much as they want you to pay for, they send you home with oftentimes no real good plan. And then you're back in the same environment with the same stressors, without oftentimes without the tools and the medical blockage that you need, so that you don't use. So, yeah, I'm hoping that insurance companies, Medicaid, Medicare, that they're looking at outcome measures and they're really insisting that that these treatment centers practice evidence-based medicine. But oftentimes they don't even have physicians, so there's no medical. They can get away with it because they don't have medical providers even at their treatment centers.
well, what about centers that like 6 months or outward bound or any of those kinds of things?
I think they so some of the wilderness trainings and those sorts of things have been shown to be effective in adolescents and in adults. I think they're more effective in substances like cocaine and marijuana where there isn't strong medical interventions.
But still, it's still a lifelong.
Right. And it's a
Process.
lifelong disease
It's a
that
lifelong
where you
disease.
need to have some sort of aftercare set up when you leave those programs.
Yeah, they don't work. I mean, I just can't even see them. They look nice, but it's no way they can work.
Right. If they're not practicing evidence-based medicine, they probably don't work. And so when I get calls, I often, almost every day, I get calls from treatment centers from across the country asking me to refer patients to them. And sometimes they'll even fly somebody in and bring a lunch. And if they don't prescribe, antabuse, naltrexone, or acamprosate for alcohol or benzo addiction, and they don't prescribe buprenorphine or methadone or naltrexone for opioid addiction, then I usually don't even take their calls or take their information down, because that's not a treatment center that I would send anybody to, because they're clearly not practicing proper addiction medicine.
And if you have a choice with someone, I mean, you don't always like to prescribe medication. I mean, you don't want people, you don't
Right.
always want to prescribe medication if you don't have
Right,
to.
right. I mean,
You're
it
not
is
a
somewhat of
pusher.
it's somewhat of a last resort, but I still want to follow evidence-based practice. And most of the times, most of my patients have tried without medicine. They've already gone through treatment centers. They've already been to 12-step meetings, and it hasn't worked. So usually, by the time they come and see me, it's for meds, and then they have success. I would say, my success rates are probably around 90%.
That's a lot.
Yeah,
isn't
it is. It is success.
That's
It's
a
extremely
lot.
successful, but that's probably pretty close to the national average. I mean, that's. I think with my training, I am a little special, but not tremendously special.
Little special, in what way?
That my success rates might be a little
Little bit
higher than average
because of the training.
because of the training and experience that I have. But I think if you see any physician with addiction expertise who are prescribing medication to treat addiction, you're going to come pretty close to that success rate.
And so, are you noticing anything as far as more heavily with men, women, anything? Are you seeing any trends in that regard?
So addictions do occur slightly more frequently in men, but it's often the women who, on a higher percentage, are coming in for treatment, and it's often because they have, they're the primary caregiver, and so because they have more to lose and more people relying on them, they're more motivated to get clean and sober than the men are, in my experience.
So, do you advocate for these? I mean, are you advocating? Are you speaking around? What do you do? A lot of that kind of work as well.
Yes, absolutely. Fortunate I've been just named to the Governor's Commission on Mental Health and Substance Abuse. So I realize that I need to be more politically active. I mean, to really have a change, statewide. I need to lead politically, but I also speak at conferences very regularly, usually at least one a month, where I'm speaking to some field of medicine, trying to educate physicians on the front line to prescribe medications that are effective in treating addiction and stop prescribing medications that aren't effective in treating addiction.
And what about physicians just not prescribing medication for addictions and sending them to somebody who knows really how to handle that?
Yeah.
I mean, that really bothers me when I see, just in any kind of therapy, somebody who needs some kind of therapy is getting prescribed medication from a regular MD with
Yes.
nothing, just medication.
Right.
That really bothers me
Yes.
because there's nothing there. It's no different than going to a 30-day program and coming out with nothing.
Right.
That really bothers me.
That I think at least that physician is trying.
Okay, so
At
I'll feel
least
that-
they're screening.
Okay.
At least they're asking questions. To me,
Well,
you're right. That's less than ideal, but that's still at least one step in the right direction.
so what do you want medical doctors to? What's the first step? Is it in knowing what addiction looks like?
Yeah, and screening for it.
Okay.
Then that simply is asking, have you, what is your alcohol consumption like?
Okay.
What is your cigarette smoking like? What are recreational drug use like? If you're not asking that very simple question, and oftentimes it's on a form somewhere, but sometimes physicians will remove that from their forms because they don't know how to handle the answer. If it's yes, I have a problem, or I'm using and I don't think I have a problem, they don't know what to do with the what's next.
Okay.
And that's where I come in and try to educate, physicians and nurse practitioners and physician assistants on what to do next.
Okay. So that's your role there. And then as far as on the governor's commission and speaking out and being more of taking more on there, what's going to be your thing?
I think it comes to funding, and I think we need to fund treatments that have evidence behind it, and we need to stop funding treatments that don't have evidence behind it. And I think that's going to be my role on the commission. We got to put our money where the effectiveness is.
Cool. Okay, so now tell everyone. I mean, and I know you're not taking any more patients, but the practice is.
Yes.
So just as a little bit, can you tell everybody, and understand that we're in North Carolina, but you can, but I guess
Yes.
Dr. Morse can fill you in on if you're somewhere else what you do.
I think if you're outside the Raleigh area, I mean, I think you can literally Google, if you put in board certified addiction psychiatrist into Google in your town, that's probably the best way to find, an addiction psychiatrist. There's also the AAAP website, which is AAAP.org, which is the American Academy for Addiction Psychiatry. And that they have a, find a doc, server that would be very helpful. But if you are in the Raleigh area, Carolina Performance, we actually have 8 addiction psychiatrists, as well as addiction counselors who are very effective in treating addiction. And our website's carolinaperformance.net. Our phone number is 919-676-9699. And I think that's a great place to start, at the very least. It's true that my practice is pretty full, and so it's hard for me to, at this point, take on too many new patients. So oftentimes, I'm still happy to talk to people and find the right fit for them. So I still have time to, if you leave me a message, either an email or a voicemail, I will respond, and I will try to find the best program for you or person for you. I'm always happy to do that. I'm very dedicated to helping people.
No question, because people have contacted me, and this is not I am there as a business coach, but I certainly have contacted Dr. Morse in the past, and I will say that it's really, and I tell this to people all the time, to be able to see that psychiatrists can have a heart is huge when you're talking about addictions. Because it is not, like we've been saying, it is not black and white. It is not an easy field it's not easy to help people with addictions. And the people that I work with have a heart. They really care about the people that they're working with. So it's really phenomenal. And I really, and I would say if you are, we haven't even talked about being a family member, because that's a whole nother thing. And we didn't touch upon that at all.
We didn't.
And that's a big deal.
Yes. You'll have to have me back.
Will you come back?
I will come back.
Okay, you will come back, and we're just going to talk about family.
Family. How to help your loved one who you think may be suffering with an addiction.
Yeah, that's a big deal. So we're going to do that. So if you do have a family member, if you are somebody, one of the things that I think you got from today, I'm sure you got a lot, is that there's hope.
Yes.
There's hope. You can get well, right?
Absolutely. No question, the treatment works. The treatment absolutely works.
So don't listen to anybody else. Don't look at anybody else. Don't listen to anybody else that's not getting help. If you want help, you can get help. And if you're questioning it and you need somebody to give you some support, connect with Dr. Morse. Reach out to me. I'll connect with you, Dr. Morse. I'm Marilyn at MarilynShannon.com. And so I want to thank you.
Oh, thank you.
You did a great job, and I appreciate so much all that you've shared and the light that you have shown on this dark area, because it really is, and it is growing.
Yes.
So it's something that we all really want to be aware of, because it's in so many nooks and crannies, and it can pop up with Facebook, for Pete's sakes, right? Email, all these things. So tune in again next week. We'll be back again, but we will have Dr. Morse coming. We're going to talk about family. So thank you so much.
Thank you.
Did we get the website?
Yeah, Carolina Performance. Yeah. And if you have any questions, just contact me at Marilyn@MarilynShannon.com. And with that, everyone, have a wonderful day. I'll see you next week. Bye.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, My Life, My Will with Gisela DiCarlo, The Tanya Love Show, Health In with Debbie Bruck, Breaking Free with Marilyn Shannon, Triangle Be Well with Howard Jacobson, Lunch and Learn with Rabbi Yisrael Cutler, Lessons of Vietnam with NCVVI members, Parent Dome with Ryan Miller, Current Affairs with Amnon Nissan. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it in the archives section on nissancommunications.com. Don't forget to subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Sponsored by Atomos.com, makers of quality video recorders and converters, CarolinaApparel.com, and DeltaForce.net.